Hi, I am Attila. I am the founder of agency carestaff.co.uk website, which is a business directory for nursing agencies and home care providers in the UK. Today I have a special guest, Tracey Clarke from Paterson Health and Social Care. Hi Tracey, thanks for accepting my invitation.
Hello Attila, thank you for inviting us today.
So, what is your background and what made you start working in care?
I'm one of the branch managers for Paterson Health and Social Care, and my background is I started working in the recruitment industry about 10 years ago. So I've been with Paterson Healthcare for about 8 years now. Before healthcare, my background was mainly in the pub and bar management, and before that as an office manager and PA for an owner of an engineering company. So managing and leadership has always been my passion, and I do love the challenge of working people to their strengths and helping them reach their potential.
That's great. So why Patterson? What made you join Patterson?
Well, I joined this particular agency after a bit of research online and after a cheeky call to one of their branches. This turned into a very good chat with one of their previous branch managers, and I ascertained that they'd got a really good reputation and they was progressive and expanding, and it looked like they'd have an opportunity for career progression for me.
How was the start there? Was it easy for you or it was difficult?
My hunch to join them was a really good decision. It was a great decision. I've been encouraged, I've had the correct training and achieved my ultimate goal of becoming a manager and managing my own area. So from starting all those years ago with a hand-picked project and a newly made-up job title, sales resourcer, I began with Paterson Healthcare and I began working on candidate attraction. During the time I worked my way through different projects and with different job roles all around the branches and divisions in the company, so my knowledge and experience grew until about 4 years ago I was offered the position of managing the MK team. This has since grown to incorporate the Aylesbury team as well, so my current area includes Bucks, Beds, Herts, MK, Northants, and my training both in-house and external continues. So to wrap it up, easy or difficult, I'd call it interesting and very enjoyable.
Okay, so at the moment you said you are the official branch manager for Milton Keynes and Aylesbury. Why should people choose your services?
Well, although it may be thought that I'm a bit biased towards our agency, I must say we are one of, if not the best, healthcare agency in the area. Our candidates are carefully selected for their experience and suitability, and we're mindful of where we place our temps and also the current needs and trends in the area. As there's such a big need for flexible care staff, we do like to work closely with our clients. Working in partnership provides them with continuity of staff, confidence, and saves them time, which obviously is valuable. So we can be the support that provides cover for short notice last minute shifts or ongoing cover while recruiting, and we're mindful that most employers do prefer to have a whole substantive team, but unfortunately there are not just the numbers around for carers that are needed. And we also care about our temps and encourage self-progression and regular additional training where required or necessary. And we pay competitive rates of pay and benefits, that goes without saying. So why should anyone come to join us? I think with our ethics, policies, procedures and general mantra to exceed all expectations, we're recognised as a trustworthy, progressive agency, and our robust recruitment procedure to ensure quality. We do retain well-trained temps, which keeps our agency the number one agency to join.
So what services do you offer?
Although I'm focused on developing and maintaining clients in my areas, our company also has other branches and divisions. So our healthcare provision covers the NHS, private hospitals, nursing, care homes, residential schools, supported living, residential day centres, home care, and now nurseries and nannies. The temps that I have registered with me range from care assistants, nurses, support workers, so people who have got experience with learning disability, autism, epilepsy, challenging behaviour, mental health. So a good range of care support staff across the board. And our company also has a training division, so offers dedicated trainers who deliver a large selection of training, including basic life support, moving and handling, along with other training that could be tailored to clients' requirements. Other divisions include general recruitment, so driving, industrial and warehouse, administration, catering and retail, so we can supply almost any sector and staff type.
Okay, so I've checked your website before you came. I've done my research a bit. And I've seen that you advertise jobs there. So who can join your services?
Anybody with the right, who has the right experience can join. And for more information on our services, the general public, prospective clients or temps, they can log on to our website like you have. And this has just had a lovely new makeover. We also use social media, so we can be found on LinkedIn, Facebook, Twitter. And we have local branches all around. So we've got branches in Bicester, Abingdon, Milton Keynes and Aylesbury. So clients and candidates can pop in and see us anytime.
So what's the process, for example, if I want to apply for a job with Patterson, what do I have to do?
Initially, we'd like you to give us a call or pop in. We encourage interested care staff to telephone. We've got a lovely team of experienced booking consultants and administrators, and they can discuss what opportunities we've currently got. Initially, we send an application form by email or post if preferred, and once we've received that back, the admin team start the registration process. We do try to get all registrations processed within a couple of weeks, 3 to 4 maximum. And now with care staff able to upload their DBS on the online service, that does speed all the processes up, so it could be super speedy, with new starters being placed very quickly into suitable positions.
How long will it take before I can start work?
If you had a DBS that was on the update service, we could get your references in quite quickly and get you booked on our training, because we have in-house training, then we could possibly get you working in 2 weeks. And as soon as you're compliant and your file has been signed off, we'll book you into your first shift. Whilst you are in the registration process, we will be identifying to the bookers that we have this super carer or super nurse that's being registered, where they live, what they're looking for, and we can start speaking to our clients to tell them we've got this lovely person coming through and what their availability will be and what our clients actually need covering.
So you introduce your new staff to your clients.
Yes.
And roughly at the moment, how many employees do you have?
Between my two branches, just myself, I have got about 300 agency staff.
Wow. So you are taking all the staff in the area.
I told you we were the best agency.
Okay, now makes sense. And how do you recruit the staff? Where do you find them?
All the usual avenues. We go to job fairs, we advertise on social media, we advertise on the job boards. We also have open days in local hotels, so you might have seen our open days adverts for ones in Northampton. These are regular. We look through lots of CVs and find experienced people, call them, invite them along to our open days, invite them to come in and meet us for interviews. But it's usually because we cover such a vast area, having an open day in a hotel is more beneficial, because people can actually come drop in, meet us, pick all the forms up, fill them in, have a mini interview. We get face-to-face meeting quite quickly.
Who does the research on the internet, or who sweeps the websites for CVs for you?
CV searches at the moment are mostly carried out by Katie in our Milton Keynes branch. So, for example, if we have got a client that we aren't quite able to 100% cover, our bookers would identify that to Katie, and she would actually source to see if there's anybody in that local area that we could recruit, along with any adverts we're putting out on the job boards.
Is it difficult to retain staff?
We're in a situation now where we've got the lowest unemployment rate since the early 70s, and with the care sector having a reputation for having lower pay rates than many other sectors, choosing to work in the care sector is therefore usually because of a personal vocation. So we do bear all that in mind, and we think we're in a better position because we're offering competitive rates of pay, we're providing good benefits to our staff, and because of this we find word of mouth is one of the main attraction for candidates, both for temps and clients. We do get a lot of client recommendations for new business coming to us through word of mouth. So it also helps direct some very good care staff, because our good care staff are recommending, they wouldn't recommend to somebody who isn't very good. So they're recommending to their good friends who they know is good. They want to keep our reputation. Our support workers and care assistants are proud of the reputation we've got.
Yeah, and you just told me that you have 300 staff members. So, right, another one. So, do you think Brexit will affect your type of business?
Well, because of the promises that have been made by the present government, lots of it on television, I don't believe Brexit will make any difference to the agency staff we currently use or that are looking to join us. We've been told that the people who are living and working in the UK that do originate from other countries in the EU will not have their working entitlement affected, and we're very proud and pleased to have such a diverse workforce, and this focuses on experience and suitability.
What training do you offer for your staff?
Training wise, we offer full day induction training at one of our local venues, and we've got our own in-house trainers, and this covers many topics including fire safety, moving and handling, basic life support, health and safety, plus many more. Our standalone training division allows bespoke training for our clients, and it can also be tailored to the requirements for our temps. And we also have the provision of online training available, so when needed we do offer this out to our temporary staff.
I've noticed that, was it beginning of this year, you started your training division?
We did.
Yeah, so you have in-house trainers.
We do have in-house trainers, yes.
Okay. So if you could change one thing in the care industry, what would you change?
Well, if I could just change one thing, I would allow more time and additional financial support to be given to these people that are supported throughout the health and social care sector. The elderly and vulnerable children and adults supported in our communities deserve respect, patience and empathy. So I think the additional finance and time would be a great benefit.
So what other divisions Patterson has?
We have the Health and Social Care Division, which does cover nursing homes, residential, supported living, schools, day centres, home care. We also have Primary Care Division, which covers surgeries, clinics for NHS nurses, doctors. We also cover general recruitment, so as I said before, we cover warehousing, clerical, driving, yep. Mm-hmm. And area-wise, we cover from my personal area, the Northamptonshire, Bedfordshire, Buckinghamshire, Hertfordshire, and our other branches cover Oxfordshire.
And do you get involved in other divisions, or you stick to healthcare?
I stick to healthcare, although my own personal branch has now moved into nursery nurses and also nannies, so that's exciting news for our branch.
Tracey, can you describe a day at your office? Because I called you on Thursday and I asked you, how are you, Tracey? You said busy. What? Well, at that moment in time, what was you doing?
At that moment in time, I had just come out of doing some one-to-ones with some of the staff, and we had a new client that had called through, so we had to ensure that everything was covered, all the paperwork had been sent back to us, so we was able to cover. And I also had somebody that was going on holiday the next day, so I was just busy making sure everything was ready for that next day.
So, okay, you start at 9 a.m?
We're open from 8:30 till 5:30. So we work between those hours, although sometimes I do work after, as I emailed you one night at 9:30.
Yeah. Talk me through a day then. So what do you do?
Being the manager, I do spend time in Milton Keynes and in Aylesbury, covering both branches. So a typical day would be to go in, make sure everybody was in. My bookers, I've got a senior booker, Imogen, who would make sure that all the bookers knew what tasks they were doing, because they take it in turns on who books where. I'd have a catch up with my developers. So I've got Reese and Sam, who are developing and also recruitment consultants. Catch up on where they'll be, what areas they'll be visiting, which clients they'll be dropping into. My admin team, which is one lady keeps everybody compliant, which is Katie, and Alison, who does my resourcing. So she's answering all the inquiries that are coming through, sending out all our application forms, bringing people in for interview when it's time, and liaising with me and the bookers on the people that we've got coming through. And obviously we do get the odd complaint come through, which usually would come straight to me, so I deal with that. Any new operational issues that I get handed down from the operations manager, Andrea, I would deal with that and make sure the whole team are aware of any new policies or procedures that have gone through. And any other business that comes my way.
Yeah, I've met Reese before, and you mentioned about developing. So what do you mean by that? What do they do?
My consultants are both 360 consultants, so they can book, they can do their own resourcing, they can do all the advertising, they can do the whole lot from candidate inquiry through to fulfilling shifts. As I have bookers already, we're utilising Sam and Reese to be the two people that actually help grow our area. At the moment, as I said, Sam is developing and looking into develop for nurseries and nannies, because she has that background and the knowledge and experience, and it's quite exciting for us because it is quite a new venture for us. And Reese is developing from Buckinghamshire up to Leicestershire and across. So at the moment, I would say that my branches, Milton Keynes and Aylesbury, cover a lot of health and social care provision in that area. Most of the people that come to my agency to join us have come from either a client or out of the area. And because we have so many clients in my area, in order to grow, we do need to look outside of our area, which is what I'm doing with Sam and also with Reese, by moving him away from where we're already covering.
I see. So they are saying that a lot of people are losing their jobs due to automatization, warehouses, and some of them are looking to start a career in the healthcare. What do you think about this? Can this phenomenon help with the staff shortage in care?
I mean, as I've already mentioned, we do look for good, experienced care workers. Sometimes we do have people approach us who've got transferable skills, and this can be usually identified face to face.
That was our fourth podcast episode. If you're looking for jobs, visit patterson-healthcare.co.uk. I'm sure they can help you. Thank you for listening. We will come back with more guests, useful information about nursing agencies, home care providers, and jobs in the UK.